Yes, welcome to the show. Like we did talk some few minutes ago, say Dr. Bati go come and most definitely Health Matter go begin. So you don't begin with that, I will say good morning anywhere where they watch us from top of the moment to you. That's your lovely program where they deal with everything we get to do with health. Now we don't carry come. So my name will never change, now still Chief Olododo. And the person will take us through this journey on top health matter. Speaking of COVID-19 pandemic, we don't start months ago. But where did he see the ravage? Where still they show himself? Now Dr. Bartholomew Ofegbolam, now be the CEO, MD Medical Grace Valley. Oga, you're welcome to the show, sir.
Thank you, Chief.
You're looking dope.
I'm pleased to be back.
We are pleased to have you here too.
Yeah, thank you very much. Good morning, viewers at home and around the world. We'll be looking at coronavirus pandemic, COVID-19. That's the official name. I must point out that it is a pandemic that started about 7 months ago. And today, I can tell you that the affectation on global rate has gone up to as far as over 14 million people. On a global scale, more than 14 million persons or individuals have been affected by this pandemic. Nearly 600,000 individuals have lost their lives. And of course, I must also point out that about 8 million people have recovered also. Over 8 million people have recovered on a global scale from this pandemic. But I want to start this morning by appreciating our Nigerian response team. We all know that the response team started from the federal level, okay, with the formation of PTF on COVID-19, headed by our own SGF, Mr. Boss Mustafa. So far, Nigeria has done or have tested over 200 samples of persons as of today, as of this moment. Samples tested so far in Nigeria, 206,422. So we have gone beyond the 200,000 mark. I beg your pardon. And also the confirmed cases we have in the country as of today.
We've tested over 200,000.
200,000 individuals. Over 200,000 individuals have been tested in Nigeria. Thank you very much. That's a major landmark. That's a major achievement. Confirmed cases we have in Nigeria at this moment stands at 35,454. Active cases in Nigeria at the moment stands at 20,049. And the number of people that have been able to recover or that were discharged from Nigeria across all the states of Nigeria, including the FCT, as of today stands at 14,633. Unfortunately, 772 persons in Nigeria have succumbed to COVID-19 contagion. These are people who died as a result of this pandemic. I also must point out that having gone beyond the 200,000 mark in terms of the number of persons who have tested in Nigeria, we have also made giant strides in a number of areas. In the testing, we are beginning to match up. At the moment, the number of labs that we have in Nigeria that have the capacity to test for COVID-19 independently today stands as 53.
53 labs.
Yes, 31 of them are in various states of the Federation. So 31 states have the capacity at the moment to test for COVID-19. 31 of these labs are scattered in the states. Also, this lab include, among the 54 labs we have, 31 are in states. We also have GeneXpert laboratories among these labs, GeneXpert machines among these labs. So a total of 53 labs are in Nigeria today, including also the private labs. And I also want to point out that very soon in Lagos State, I do know that one or two of the privately enlisted labs have made they've taken off, and a good number of them have actually made arrangements to have a drive-through testing so that one can easily drive through and get tested. But I must also point out that concerning the private labs that we have in Lagos, at least I can give an idea of what we expect to pay in terms of the test. For the private labs, the payment will be in the neighborhood of 50,000 or roughly above that. At least I've seen one of them that actually placed out the payment. And I must also point out that this payment, 50,000, to just get this test done, I do know that not many Nigerians will be able to afford that. Okay, so we still need the government to help us in this regard.
Do you say many Nigerians will be or not many Nigerians?
Not many Nigerians will be able to afford that, sir. Not too many Nigerians will be able to afford that. Also, let me also say that, having pointed out that we now have private labs that one can actually walk in and demand to be tested. These private labs are not going to go by the case definition, which is actually the criteria for getting tested in government-owned labs. And I also would like to point out at this stage that government-owned labs do not collect any money from anybody to get for such a person to get tested. Okay. So you're not supposed to pay anything if you're getting tested in any of the government undertaking labs. But if you want a personal test done on account of maybe a statutory requirement for you to travel abroad or to do some other official duties, you're expected to pay a handsome sum or a whooping sum of about 50,000. Okay. Now, but that said, people who fit into the case definition, case guidelines for persons who should get tested, still have the available opportunity. They still have the opportunity of getting to any of the government testing center and going through the normal procedure, and those set of people can actually get tested without paying money. It's important I point that out. Also, I would like to point out...
sorry, before you move further, sir, okay, maybe I should let you...
No. Okay, no, I can take it.
When you talk about the testing, I'm just beginning to think in my head that the reason, like, what is the duration? Should I test what I go do today, come back for results in 2 weeks' time or 3 weeks' time, or an instantaneous thing?
Now, thank you very much for that. The method or the methodology that I use or that has been accepted, validated in Nigeria today is still the real-time PCR, real-time polymerase chain reaction. On the average, it takes about 48 hours for us to get a result. Okay. But I do know that gene expert machines have the capacity to test for less than that. Okay, so we may have a situation where we'll be able to have a drastic reduction in the turnaround time that we need
to get results.
To get the results out when anybody is tested. Okay, so I do know, but I'm not sure if that has started already. But I know gene expert machine can actually give a result within hours. So you don't have to wait for 24 to 48 hours to get your result. But with these new labs that have come into stream, that have been enlisted, we expect more Nigerians to get tested. But that said, all that we have done so far are still like a drop in the ocean. So we need to increase what we are doing. We need to increase our testing capacity because it's testing. That is according to WHO. If we actually need to, in public health emergencies, number one, you need to increase your capacity to test. When you test, you need to isolate those individuals that have been tested. When you isolate those individuals that have been tested, those ones that have tested positive, they need to commence treatment. This also brings me to the fact that currently in Lagos State, for instance, the number of active cases in Lagos as of today stands at about 11,092.
11,092.
Now, this from the NCDC website, these numbers are assumed to be on admission. But in reality, these numbers are actually not on admission. While I was going through the infographics from Lagos State this morning, I realized that there's a column where the commissioner was actually highlighting. Okay, I think I will have to read it out directly. That's from Professor Aki Abayomi, the Honorable Commissioner of Health in Lagos State. He said that the total number of tests that have been conducted in Lagos State at the moment is about 50,831. This was about 22 hours ago. And he said that a total of 1,922 individuals have been confirmed have been discharged from COVID care centers following full recovery. That's almost about 2,000 people that have been discharged from Lagos State. And he said 277 of the cases are currently under public and private care centers. And he also went on to say that 8,326 of the confirmed cases monitored in communities by the hashtag COVID-19 Lagos response team have either fully recovered or positively responding to treatments. And then the next line says 1,943 active cases in communities are yet to turn up for admission in COVID isolation centers. So you still have close to about 2,000 people who they cannot account for, who have resisted coming into isolation center and getting treated. And of course, you and I know the implication of all of this. That means that these numbers will keep staying in the community and they will
polluting this community.
That's the right word. And of course, anybody who is around such an individual can get infected. And that also reinforces the fact that we need to take personal responsibility, because at this stage of community transmission, you can actually not say who has it or who does not have it around you. It's very important. Okay? Coupled with the fact that just about a week or so ago, WHO has actually come out to acknowledge that this infection can be airborne. Now, if this infection can be airborne, it reinforces the fact that you and I have to take responsibility to ensure that we put on our face masks properly anytime we're in public spaces, not just for ourselves, because if you do all of this, for example, if you work in an organization, you are as strong as your weakest link. If you work in an organization and you ensure that you put on face masks, but there are still a number of persons in your organization who do not go with face masks when they enter public transport, those set of people can actually endanger your own life and that of your family. We have seen a number of affected families where we learned that those people actually became infected as a result of having somebody who probably does not take responsibility coming into their place of abode. Okay? And we must also ensure that...
No, our family is my younger brother. And my friend now.
This was a case of a domestic staff said to have been infected and then coming into a family that were obeying and following the government regulations to the letter. And at the end of the day, a number of family members were affected eventually.
Because apparently he's the one taking care of the whole house, cooking for them and everything.
Of course, one of them ended up dying as a result of the scourge. Okay, so that is what can happen in an environment when you are just concerned about yourself and your family. You need to ensure that everybody around you obeys the government guidelines, because that's the only way we can help to prevent the further spread of this transmission in our communities. I also would like to point out, at the moment, I would like to look at the affectation in the African sub-region. At the moment, South Africa has gone up to the 6th. South Africa is the 6th worst affected country in the whole world. Yes.
But I thought South Africa started so well with their testing and everything. What went wrong?
No, it's not in terms of testing, sir. It's not in terms of testing. And I must also acknowledge that South Africa, in spite of the large number of the people affected in South Africa, they've done very, very well. So far, they've done over 2.3 million tests. At the moment, the number of people that are affected in South Africa stands at 337,594 people. 337,594 persons have been affected in South Africa. And over the night, they recorded new cases of about 13,373 persons. I also would like to point out that in spite of the fact that South Africa has jumped to 6th on the list, the total deaths in South Africa is still below 5,000. The number of people that have died in South Africa to this scourge as of today stands at 4,804. And when you look at the numbers, some of the other countries that are below South Africa, you can see some other countries where over 37,000 people have died, over 45,000 people have died. So that speaks volumes about the clinical care in that country.
Well, thank you very much, Dr. Bat, for this lovely information where you give us. We'll take open up. Most definitely, you know, as we take do. We'll go on this break. When we come back, we'll open the phone lines so that you self go fear as Dr. Bat. Anything where they do your mind, yaga, as far as COVID-19, if they concern. Not forgetting also, say if you take advantage of with Skype and do you feel call us through Skype. We are hiding a WAP TV. So let's go on this break. We will be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit interact with us on top the show or talk to the doctor through we phone numbers wey be 08173147589 and 08105434984. You still fit call us on top we Skype ID wey be WAP TV. You fit also advertise your product and services on top we show where they help people. Terms and conditions apply, shall.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
I wanted to ask about the New York Times report previewing an open letter to be published by 239 scientists from around the world calling for the WHO to give greater acknowledgement to the risk of an airborne spread of COVID-19. First of all, I wanted to get your reaction to those reports and to see where WHO's research stands in terms of where we are.
Thank you for your question. So we have discussed and collaborated with many of the signatories of the articles that you have mentioned over the last few months. And indeed, we discussed the available evidence that has been discussed in these pieces. And also, we received contributions from many of the signatories of these pieces. We acknowledge that there is emerging evidence in this field, as in all other fields, regarding the COVID-19 virus and pandemic. And therefore, we believe that we have to be open to this evidence and understand its implications regarding the modes of transmission and also regarding the precautions that need to be taken.
Thank you, Benedetta. Just to say that, yes, we have been engaged with this group since April, when they first wrote to us on April 1st. And we've had an active engagement with them and with many of the signatories on this through different networks. And as we have said previously, we welcome the interaction from scientists all over the world, from many different disciplines. Many of the signatories are engineers, which is a wonderful area of expertise, which adds to growing knowledge about the importance of ventilation, which we feel also is very important. We have been talking about the possibility of airborne transmission and aerosol transmission as one of the modes of transmission of COVID-19, as well as droplet. We've looked at fomites, we look at fecal oral, we look at mother to child, we look at animal to human, of course, as well. And so we are producing a scientific brief on summarizing where we are. We've been working on this for several weeks now. And we've engaged with a large number of groups, epidemiologists and clinicians, IPC specialists, engineers, mathematical modelers, to try to consolidate the growing knowledge around transmission. But we have spoken about the importance of all of the different potential modes of transmission. This is a respiratory pathogen, and so it is important that what we know fits into the guidance that we have, which is why a comprehensive package of interventions are required to be able to stop transmission. This includes not only physical distancing, it includes the use of masks where appropriate in certain settings, specifically where you can't do physical distancing, and especially for healthcare workers. So our focus on the use of masks, of course, is for healthcare workers, and to use airborne precautions where you have those aerosol generating procedures. But we're also looking at the possible role of airborne transmission in other settings where you have particularly closed settings where you have poor ventilation. So we will be issuing our brief in the coming days, and that will outline everything that we have in this area.
Yes, you're welcome back to the show with all the statistical analysis where the doctor don't give us, on top the number of persons we will don't test, on top the number of labs we will get. We even put presently at 53 labs, 31 scattered nationwide with some other private labs, all working. We also make us realize, say, well, vis-a-vis, at least it is within the range of 50,000 naira to get tested for now. And tell us the number of active cases we will also get for Lagos. He puts it at 11,092 Lagos, and I will get for active cases. Plus, even tell us the number of those people who say they've been piante away from medical care. All these and many more, now don't tell us, and more you never to miss. If you just join us, never to miss, because we still have the second half now. The second half now, we won't enter now. Where you go see here for the doctor mouth. Remember, you can feel call us, and at the number 9 day your screen. So reduce the volume on your TV set and go straight to your questions. Plus, if you call us again for we Skype call number there, we say once you enter Skype, just you go see WAP TV, click am, and we go to see you live, see you and your family. Dr. Bag go get to see you and attend to you. That one a physical seeing now. They call am woro si woro. We go look at ourselves like this. We go check you. Okay, oh yeah. So Dr. Bat.
Yeah, thank you.
Before we went on that break, you were doing justice to Africa. The South African numbers vis-a-vis some other African countries. So I don't know if you'd like to pick up from there.
Yeah, thank you very much. We've given the figures for South Africa, and we said that at the moment, South Africa is number 6 in the world. Has gone beyond Italy, Spain, UK, and what have you. And at the moment, South Africa has 337,594 infected individuals. And over the last 24 hours, South Africa recorded 13,373 new cases. And of course, I also pointed out that despite this large, massive number coming from South Africa, the fatalities, the number of people that died in South Africa is still 4,804 persons.
That means they were able to manage their fatality.
They were able to manage it very well. And we are proud of the work they are doing. They are health caregivers, the frontline health workers in the whole of Africa. We are proud of the work that they are doing. And we're also proud of what our Nigerian team is doing as well. Yeah. Okay? It's not easy. Like I said at the beginning of this pandemic, when he first arrived in Africa, when he first arrived in Nigeria, at the time he arrived in Nigeria, we had only 5 labs that have the capacity to test for COVID-19. And since then, a lot of development, massive improvements. We've been able to ramp up our capacities in such a way that at the moment, we proudly have 53 labs in Nigeria, scattered across the states, Federal Capital Territory, and very soon we'll have labs in all the states of Nigeria. Now, Nigeria stands, Egypt is next to South Africa. I'm looking at the statistics from Africa now. Egypt at the moment has 86,474 individuals that have been infected by COVID-19. In the last 24 hours, Egypt has seen 703 cases. And the number of deaths in Egypt, just like South Africa, is still below 5,000. 4,188 people have died in Egypt.
But doctor, what is really responsible? How have they been able to really manage their fatality, knowing full well say they get them. Is it that immediately they get them, the people they surrender themselves quickly for treatment, or how they take manage this fatality rates?
We do know, thank you very much for that question. We do know in medicine, when you have a challenge, a medical condition, and you're able to get to hospital on a good time, the outcome will likely be better.
Wow.
As compared to when you have a medical challenge.
And you don't eat deep.
By the time you are getting to the hospital, it has probably gotten to an advanced stage. At that time, the outcome may not be what you expect it to be.
Okay, let's take Abdul Sadiq, sir. Abdul Sadiq, good morning.
Yeah, good morning.
How is Gombe?
Gombe is fine. Good morning, doctor.
Good morning, my brother. How are you today, sir?
I'm fine. Thank you. How is the weekend?
Fine, thank you, sir. It's going well, sir.
We really appreciate you. You are doing a great job. We really appreciate
Thank you very much.
Sadiq.
Thank you very much, sir. We
Yeah,
appreciate
please, doctor, my question is, for example, when someone go to a remote area, a rural area, and you see someone with complete symptoms of COVID-19, and in that community, you hardly have a single person that has the emergency number of to call the attention of the health personnel, and to transport that person to the city where he can get tested will be very difficult. You even risk your life, your health for transporting that person, since you don't have the protective equipment that you can use to transport that person. In that situation, what can someone do as a layman to assist that person in a rural area? Secondly, please, doctor, I want you to use this your medium to call the attention of government, because we here in the north, especially in the northeast, the level of compliance is very low. Wedding ceremony is taking place day by day. You will see more than 200, 500 people in the wedding event, but you hardly see one person using a face mask. It's very risky. We are in a serious danger. Please, I want you to use this your opportunity to call on the attention of the government to make it mandatory, or if they cannot suspend the wedding event, let them make it necessary for them to wear these face masks, because our lives will be in serious danger. Or even the marketplace, you see 20,000 people in the market, but you hardly find up to 100 people using face masks. I think it's really serious, this thing. So we need to call on the attention of government so that they can do something about it, because this thing is real. So we need to wake up and do something about it. Lastly, doctor, please, how can someone differentiate between, since sore throat is one of the symptoms of COVID-19, how can someone differentiate between the sore throat of COVID-19 and the normal sore throat? Is there any difference, or is there any way that can someone differentiate between? Because it is normal. Someone may be having sore throat, especially during rainy season. So how can someone differentiate between the two? Thank you.
Thank you very much. Thank you very much.
Thank you very much, Sadiq.
Those powerful 3-in-1 questions, sir.
Maybe the 3 years. The first one is the person in remote area. Said if somebody in remote area has it, how do we attend to such a person where we can't reach NCDC?
Yeah, as he was asking the question, I was also thinking along that line. What can such a person do? Number one is that I don't know if it's going to be possible for our technical department to see those numbers. I think we have shared them some time ago. Well, if it's not possible today, I promise that by next week, I'll make sure that those numbers are shown again. Now, the government position is this. If you think you have somebody that you suspect that the person could be having COVID-19, what you are expected to do is not to take the person to your regular hospital. What you're expected to do is to call your state hotline, your state hotlines, some certain numbers, okay? Each state has its own hotlines that you can reach out to. You can call and then report, narrate whatever problems you think such a person has. And then you ask on instructions thereof they will tell you from that point what you are expected to do and how they can reach such an individual. That is what we have been told to do, okay? But of a truth, sometimes you may make these calls and it will not connect, especially if you're in a rural area where GSMs are not easily available. They may have challenges communicating and getting across to those state hotlines. So for such individuals, what will they do? Okay? If indeed they would like to help out such a person who is so stricken. Okay? Now, what I think the person can do, as much as possible, what I think the person shouldn't do is to make an attempt to go and rescue such a person and take such a person to the hospital. Okay? Because if the person has COVID-19, you will get unduly exposed, and in the process, you can equally get infected. And of course, if you have a pre-existing medical condition like diabetes or hypertension, or if you're advanced in age, the person you're trying to help may even survive, and you may not be fortunate. Okay? So what I think we can do in such scenario is to make an attempt to see how we can reach those government numbers. If we can't reach them, we can send text messages to them. Find a way of getting across to them by way of sending text messages. In a rural setting, you may not have internet facilities. Yeah. So going online too may not be the best. Okay? And then you, additionally, you may want to check out, you may go to some of the local hospitals you have in such environment or state-owned hospitals and physically make a report so that they can come and attend to such an individual. So that they can come and attend to such an individual. Now, if this were to happen in a city, I can tell you today that a good number of people who may not even have COVID-19 disease are being denied critical care in a number of facilities, be it government-owned and privately owned hospitals. People are being denied care. And one can understand the reasons behind this. The government has given out a set of symptoms that when one is presenting with, you should call government hotlines so that they can tell you what you can do from that moment. They've also told private hospitals that are not accredited. At the moment, only 3 are accredited in Lagos. I'm not sure if any other one is accredited outside of Lagos. Okay, so they've also warned private hospitals that are unaccredited from getting involved, from treating COVID patients.
Sorry, let's
take Omotosho from Abuja.
Good morning, Omotosho. How are you doing?
So we have 2 more.
I'm fine. Good morning.
Yes, 2. Good morning. The doctor is here, Omotosho.
Okay, good morning, sir.
Good morning, Mr. Omotosho.
Good morning, sir. I have a question, sir.
Yes, go ahead, sir.
Okay, sir. The question goes like this. Like here in Abuja, in Duse precisely, we have been having about testing. We have been testing people, but we did not see any test here in Duse side, in Abuja here in Duse. Especially in my own personal area that I'm living, this is in 7 years. Nothing like test.
Where are you living, sir? Where are you living?
This is in 27.
Did you get that?
Buhari Area Council.
Yeah.
Buhari area.
Buhari Area Council.
Okay. Go on.
Nothing like test. And for these reasons, if people are just going to their daily activities without testing, without anything, how could we combat this coronavirus of a thing that we are talking about, sir?
Thank you.
Thank you very much. Thank you very much. Yeah, thank you very much. He made a very some salient points there. Okay. I do know that the testing centers are not as widespread as we would wish them to be at the moment.
Like
but
that.
Considering where we started, from just 5 to today 53, I must also give a pass mask. I must be very honest, it is difficult handling some of the challenges. Having to battle with the shortage of supplies on a global scale, everybody is competing for the same thing at the same time, for these medical supplies. So we must give some credit. My advice is that I do know that Abuja has 4 or 5 testing centers. Okay? Wow. Before the end of the program, if I have the time, I will mention some of those testing centers we have in Abuja where you can actually go and get tested. But however, you can't just walk in and say you want to do the test. You must fall within the stipulated guidelines. Okay, you must fulfill them before you can be qualified to have the test done. If you get into such a place, I said, I just want to know my status, I can bet you nobody will test you. You have to go to the private centers, okay, and get tested, where you can actually have to pay for it. But if you fall into the national specifications, the guidelines for getting tested, if you are sick, if you have some set of symptoms, you have been exposed to somebody who has been confirmed positive, and a good number of other criteria, if you satisfy all that, you get tested even without having to pay. Nobody pays in government centers, okay?
Sorry,
now,
let's go back to Sadiq. Sadiq talked about sore throat too.
Yes.
Differentiating between normal sore throat and sore throat during coronavirus.
Thank you very much. There is nothing like abnormal sore throat or normal sore throat, okay? But those sets of symptoms, I must admit that it is difficult to actually separate those set of symptoms and say these ones are for this particular disease entity, while these ones are for this particular one. It's difficult. However, we do know, the scientific community has told us that COVID-19, there are some 3 major symptoms that you need to look out for.
Let's take Rejoice. Rejoice, good morning.
I've reduced the volume.
How are you doing?
I'm fine. I say the problem is that I'm breastfeeding.
We can't hear you, please. We didn't really get that.
Hello?
Hello, we can hear you. The problem is what?
Is that I'm breastfeeding and I don't want to get another pregnant because the kid is small.
Oh, she's breastfeeding and she's not ready to have another child because the baby is still small. So you want to ask the doctor what you can do?
And the thing is that I need an advice from you, or what kind of drug should I take?
Okay.
What kind of what?
Drug can he take? Okay, I think we have to do it this way. The doctor's number will be displayed on the screen now because that sounds a bit personal. So that's his number on the screen. MC, I'll just leave it there. You have to call the doctor via that number 08039256954. 08039256954. Rejoice, I hope you have that.
So if you can't call, you can also text me. You can send a text, and of course, I'll be able to reach out to you, and then we'll
that sounds a bit personal. So you were talking about
text messages can equally be accepted. That's just what I'm trying. Just in case one does not have, one cannot call for one reason or the other.
Differentiating between the sore throat.
Yes. Now, to differentiate between sore throat coming from COVID-19 and another sore throat coming from any other, maybe upper respiratory tract infection, it will be a difficult thing to do. Nobody can actually do that, okay? Because this set of symptoms can actually be found, they are similar in a number of disease conditions. However, the scientific community has told us that there are some major symptoms that are typical of COVID-19, and we keep repeating them. Number 1 is fever. Number 2 is dry cough. The person may have dry cough that is persistent. And then number 4 is difficulty in breathing, okay? Or shortness of breath, okay? Now, if you have, there are newer symptoms now that have been added. If you have a sudden loss of smell or taste, all of a sudden you just discover that you cannot perceive smell again. Okay, we'll be right back after this short break.
Okay, most definitely. Let's go on this break. When we come back, we're able to talk about this new one where Dr. Badi talk about now. So if person no be smell well, check yourself out. Let's go on this break. We'll be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit interact with us on top the show or talk to the doctor through we phone numbers wey be 08173147589 and 08105434984. You still fit call us on top we Skype ID wey be WAP TV. You fit also advertise your product and services on top we show where they help people. Terms and conditions apply, sha o.
Hello. Today I'd like to talk to you about how to wear a non-medical mask. also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19. Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
Yes, you're welcome back to the show. You don't hear from Dr. April Bola. I like that, her name. She's a baller anyways. She did teach us the ways to wear the face mask vis-a-vis how to stay safe. So, Dr. Bat, before we went on that break, Abdul Sadiq asked us 3 questions in one. The one of the remote area, we've done justice to that. The one of the sore throat, we've done justice to that, and the call to government vis-a-vis the
Northeast. We're actually on the second one, the one that has to do with the sore throat. Okay, when we went on the break. Okay, so let me do a recap. I also like the technical department to help us highlight on our screen those set of symptoms that when we see, we'll need to start suspecting that such an individual may be having COVID-19. I also pointed out that the 3 major symptoms for COVID-19 are actually dry cough, shortness of breath or difficulty in breathing, and of course, yes, we can see them on our screen at the moment.
Fatigue.
Yes. Those are the set of symptoms. And I also added that additionally, if you have a sudden loss of sense of smell or sense of taste, you suddenly cannot perceive the fragrance of your perfume anymore, or you cannot taste taste any food anymore, is an indication that you need to have yourself checked out. Okay,
those are the additional taste.
Yes, those are the additional symptoms we have for COVID-19. You know, it is a disease that is evolving. Okay, a lot of things that were known about the disease at the beginning of the pandemic are not what we know today. There's a continuous improvement of knowledge about this disease.
As it's evolving, we are evolving too.
Yes, based on the outcome of research that are going on in a number of countries of the world. And I can tell you that apart from that, that we're beginning to see a rapid increase in a number of countries. It's a different stroke for different folks. Some countries are beginning to see their numbers drop down, while other countries of the world are still seeing daily spike. WHO said on Thursday, WHO recorded what was regarded as the highest daily toll in a 24-hour period. Okay, in one day, it more than new cases that was recorded in one day on a global scale actually went beyond 260,000 or thereabout. Now, in the US, for instance, in the last 48 hours, they had a new daily toll of almost 75,000 just in one country.
75,000?
Yes, 74,987. That's from Odometer. That's the link I'm reading from. Okay? And then the Johns Hopkins University tally is equally something close to that. Ditto for Reuters. Okay? So at the moment, US has over 3.7 million people affected. Brazil has over 2 million people that are currently affected. India has gone past the 1 million mark. And our own South Africa, we said before, has jumped to number 6 on the list. Let's look at our own figures. Nigeria is third on the list in Africa, next to Egypt, with 35,454 cases, laboratory confirmed cases in Nigeria. And in the last 24 hours, Nigeria recorded new cases in Nigeria were 600. 600 individuals have been discovered. The total deaths we have in Nigeria as of today is 772, unfortunately.
700.
And the new deaths we have in the last 24 hours was 3. we haven't even gotten to the peak of the pandemic. And this takes me back to...
But must we get to the peak?
We have to. It's a public health emergency. Now, going back to the question that Sadiq asked, we are begging Nigerians, wherever you are, government cannot do it all alone, okay? We need to be our brother's keeper. We need to help each other. We need to encourage one another in this pandemic so that we can weather the storm. I can tell you that before now, when we had lockdown in place, okay, you can say that this particular state has so and so figures, this particular state has so and so figures, and people here may feel unconcerned about what is going on in another state. Not anymore. I can tell you that the infected people can actually move from point A in the country to a point B. Okay, so it's everybody's business what your neighbor does. So if you're in a gathering and you have over 200 people, you need not be in such a gathering. You need to find a way to live such. That place shouldn't be for you, okay? Especially, okay, what is permissible at the moment is gathering of less than 50 individuals, okay? In some settings, it must be less than 20. So if you're in a place and you have over 200 people gathered for any reason, that place should not be for you, even when you're putting face masks. And again, when you consider the fact that we have been told that there's strong possibility that this COVID-19 disease or contagion is airborne. What that means is that somebody can just sneeze in such a crowd and tens of people will get infected by just inhaling the droplets that have escaped into the space in such a gathering. So just like Sadiq is begging, I also want to believe that the authorities are listening to some of those questions that we are getting. We are begging on all Nigerians to take responsibility. It is not a government business only. It's a collective responsibility. Everybody must be involved. If you're putting on a face mask and the person who is seated next to you in a bus, in a tricycle, is not putting on a face mask, please encourage the person. If the person does not have one, if you have to, pass one to such a person. By so doing, you protect yourself and you also protect the people around you. Also, there's other questions that I would like us to also consider, okay? Now, let me start by saying that with what is going on in Africa, before now, we were seeing those high figures in some other countries of the world, but we are beginning to see all of this happening to us. Before now, we were nurturing a number of opinions that the African man, because of the sun, the heat we have in our environment, because of this and that, we are not as affected as other people.
Europeans.
But that is beginning to change. That is beginning to change. If South Africa could see 136 people dying in one day, okay, we've also seen situations where we recorded over 20 people dying in one single day in Nigeria. But don't look at these figures. We have said it before that we are truly underreporting. We have not been able, despite the fact that we have done a lot of improvements in our testing capacity, we are currently still under testing. We are not giving the true picture of what is going on in Nigeria. So a lot of people who are dying of COVID may not be captured. Okay? So don't get confused with those figures that you're seeing. If anything, we're underreporting.
Okay, thank you very much, Dr. Bat, for the very, very good information where you give us on top COVID-19. Most definitely, if we come your way next week again, we'll give you terrible, information on top COVID-19 because we realize the thing now, as it happen from Monday, enter Saturday, Dr. Bat go pack the new ones. Come. He don't tell us the latest one now. Say if you know if you smell something well, you know if you determine taste. Say now the latest one be there to make you quickly go check yourself. He don't even give us how much the test itself be from one place to another, plus the number of laboratories we will get. Most definitely next week, we have one laboratory day for each state. I know say Dr. Bat will help us look into that so that we'll go fit talk. Say for Abuja, go here. For Lagos, go here.
And as well as the numbers to call, the hotlines.
So thank you very much. Bye-bye.
See you next week.